Story 1. My work buddy suddenly said, "Yo, man, your neck looks fat." I was like, "What the hell? That's so rude." He insisted it looked fatter than before and suggested I see a doctor. So I did. It turned out to be thyroid cancer. My coworker caught it at stage 0. I didn't even need chemotherapy. The doctors removed the gland. I'm on lifelong thyroxine, but that's the best outcome. My work buddy and I still keep in contact 15 years later. Story 2. I am going to speak on behalf of my sisters Charlotte and Connie, who are no longer here. My middle sister Connie was a non-smoker, married, had just bought her first home, and waited tables at a restaurant chain. She had 2 children. She developed a dry, nagging cough, went to the doctor, had a chest x-ray, and was told everything looked good. The cough continued, so 3 months later she went back. This time she was diagnosed with stage 3 lung cancer. She had a lobectomy and received such heavy doses of chemotherapy that I thought she would die from it. She had scans every couple of months, and we held our breath between results. 1 year later, the cancer metastasized to her brain. Surgeons removed what they could of a tumor in her frontal lobe, followed by radiation. 6 weeks later, the tumor returned and was larger. My sister said no more. She passed away at home at age 42. Her little girl was only 5. My younger sister Charlotte was married, had a grown daughter, and was living comfortably. She had recently had hip surgery but was otherwise in excellent health. She was in great shape, had a swimming pool, and used it frequently. One day she noticed a discharge from her left nipple. She dismissed it as irritation from too much chlorine in the pool. Thanks to our grandmother, a breast cancer survivor who kept on her about getting checked, she went to a doctor and was diagnosed with breast cancer. She had a mastectomy and began chemotherapy. After treatment, she went for regular checkups. 5 years passed and she was considered cured. Then she was diagnosed with a brain aneurysm, most likely related to damage to her veins from chemotherapy. My younger sister died on the operating table at age 52. I miss them every day. Please get checked. Story 3. My symptoms were a feeling of fullness in my bottom when sitting down and bright red blood in my stool when wiping. I was 40 years old at the time and visited my doctor right away. She dismissed it as hemorrhoids. Within 2 months, my stools changed shape and I started to lose weight. I contacted my doctor again and was referred to a gastroenterologist. From the onset of my symptoms to when I finally saw a specialist was 6 months. They ordered a colonoscopy, but my health insurer initially denied it. My gastroenterologist appealed and moved the procedure to a hospital before it was approved. By the day of the colonoscopy, I had lost 45 pounds since first seeing my doctor. When I woke up from the colonoscopy, my gastroenterologist told me they found a 7-centimeter mass that was likely cancer. Biopsies confirmed malignancy a few days later. Blood work and a series of imaging studies over the next month led to a diagnosis of stage 4 rectal cancer with metastasis to the pelvic organs, the lungs, and 1 adrenal gland. This was in May 2025. I am almost through my first phase of treatment. 8 cycles of folinic acid, fluorouracil, oxaliplatin, and irinotecan chemotherapy. I start cycle 7 tomorrow and should finish cycle 8 the first week of November. My next treatment will be 25 to 35 cycles of chemoradiation. As of today, no cancer deoxyribonucleic acid can be detected in my blood. My primary tumor is now undetectable on imaging, and all my metastasized nodes have shrunk by more than 50%. Story 4. Shortness of breath and low energy. I thought it was a resurgence of the asthma I had as a child. It turned out I was severely low on hemoglobin. Leukemia had replaced 92% of my bone marrow with cancer. That was 18 months ago. I have been in full remission since January. I do not recommend it. Story 5. One day I had a sudden, complete bowel obstruction. I knew what it was because I was a nurse and went to the emergency department right away. They did scans and I had surgery that night. I already had stage 4 bowel cancer. The only symptom before that was some very mild constipation that I attributed to not drinking enough water. This was in May 2022. I am still here and grateful for every day. I hope this serves as a warning to others. Any change in bowel habits can be a sign of something serious, so please see a doctor. Symptoms to watch for include constipation that lasts more than a few weeks, blood in the stool, abdominal pain with cramping or bloating, unexplained weight loss, stools that are narrower than normal, and a feeling that you cannot fully empty your bowel. Bowel cancer is increasing, especially in younger people. Be aware of the signs and ask for a colonoscopy if you have symptoms. Do not let a doctor tell you that you are too young. Check the statistics. Story 6. About a year before I was diagnosed, I had a sharp pain in my hip so severe it left me doubled over. It lasted only a couple of seconds and occurred once, so I did not follow up. During a preoperative evaluation for an unrelated surgery, my doctor found a lump in my breast. She sent me for a mammogram, I had a biopsy, and I was diagnosed with breast cancer. The hip pain turned out to be a tumor in my hip. My cancer is metastatic. As of June, I have no evidence of disease, and I am enjoying it as much as I can. Story 7. I felt a lump on my breast that I had not noticed before. I thought it might be a cyst since it seemed to come out of nowhere, and I had no other skin changes or symptoms to indicate anything serious. At the time of my diagnosis, I had stage 2B triple-negative invasive ductal carcinoma. Story 8. My period would not stop even after an endometrial ablation. It was lighter but still persistent. Otherwise, there were no symptoms, although I had some cramping during sex. They performed an ultrasound and found a mass on my ovary. A few weeks later, they imaged it again and it had grown. They wanted to monitor it, but my husband insisted on further evaluation. He contacted the right people and arranged a magnetic resonance imaging scan. The diagnosis was ovarian cancer that had already spread to the liver capsule, stage 3B. I underwent major surgery and 6 rounds of chemotherapy. I am still here. I will be 3 years cancer-free in December. Story 9. A red spot on my arm would not heal. After reading on Reddit that a similar spot had been cancer, I scheduled a visit with a dermatologist, and sure enough it was a melanoma. After more than 30 stitches, I'm okay. Story 10. I got super lucky. I was lying on the couch at 17 and realized I was rubbing a lump on my back. I went and showed my dad. My parents were divorced, and by chance he was renting the master bedroom to a nurse. He walked me down the hall, knocked on her door, and had her feel it. She said it felt hard and I should get it checked out. The next week I was in a doctor's office. Less than a week after that I was having it removed. 2 weeks later they removed the stitches, and at that point they still did not know what it was. 3 laboratories failed to determine it. It had to be sent out of state, where it was finally identified as a very rare and aggressive soft tissue sarcoma that kills 60% of the people who get it. They do not even use chemotherapy. They go straight to surgery and amputations. I had a second wide excision surgery along my spine, with over 24 stitches for an original 2-centimeter lump to remove the surrounding area. Everything came back clear, and we basically caught it before it spread because we rented a room to a nurse. If my parents had not been divorced, I would probably be dead. Story 11. Sorry for the long story in advance, but it still feels kind of unbelievable even though it happened to me, so I have a habit of over-explaining. I started getting a little dizzy every time I stood up. I was around 50, so it did not seem alarming at first, just annoying. It kept getting a little worse over the course of a week, but I ignored it, thinking I was just tired since it did not happen when I was sitting or standing, only while standing up. On day 6, it started causing me to hear my pulse in my ears when I got dizzy. I wrote to my primary care physician to ask if this was urgent or if I should make a regular appointment. The next day, the pulse evolved into temporary hearing loss, and my eyesight began fading. I went to the emergency room. I walked in and asked to see someone. A nurse looked at me and said, "Wow, you look pale. I think we need you to skip the line. Come with me." They drew blood for urgent labs. We chatted for about 10 minutes while they ran them. My hemoglobin was 4.0 grams per deciliter, which is so low for someone who can walk and talk that they thought the lab made an error. Normal is roughly 14.5, and a 7.0 will usually prompt an urgent transfusion. They drew more blood, came back 3.8. The nurse said she had never seen anyone with such a low number who had not been shot, let alone walked in and seemed lucid. I immediately got a room and had 8 pints of blood transfused back to back to bring me up to 8.0 grams per deciliter. I am 6 feet 5 inches and a bit overweight. They sent me off for a CT scan to find out why I was bleeding. Turned out I had a rare form of pancreatic cancer. It had grown from the tail of my pancreas into and around my spleen and was heading toward my stomach. It had blocked enough blood vessels that more than a dozen were bulging and could burst at any minute. One of them had burst into my stomach, and I had been digesting my own blood for more than a week. All told, they think I lost something like 80% of my blood supply without realizing anything was seriously wrong. After all was said and done, my tumor measured 19 centimeters, but had somehow not metastasized. The surgery to remove it included taking my spleen and 2/3 of my pancreas, along with a few dozen lymph nodes, all of which were clear of tumor cells. I asked the doctor to take a picture of what he removed just out of morbid curiosity. He showed me the next morning. It was a little over 2.5 pounds and looked like a small pork roast. I sent that picture to my fantasy football chat asking what type of barbecue rub I should put on it. Summary: I felt dizzy every time I stood up for a week, had a massive stage 3 pancreatic tumor, lost most of my blood supply without realizing it, and had surgery that resulted in rapid weight loss. Edit. Here is a picture of what was taken out the first time. Warning: it is gory and not safe for life. Also, it was more yellow and darker than I remembered, so it is actually the size of a small roast but looks less like one than I thought. I never saw it in person. It went to pathology for sampling before I woke up. Story 12. Even more remarkable is my oncologist's story. She had a random pain in her breast. Labs looked good and the mammogram was normal. She saw several other doctors who also said it was nothing, but she couldn't shake the feeling that it was cancer. She pushed for a biopsy, but something told her to have both breasts removed, so she elected to have a double mastectomy. She had cancer in both breasts that she caught early. She is so amazing. If I so much as mention my eye is twitching, she asks, "Do you want a scan? Let me send you to the best eye doctor I know. Let's do this." Story 13. I found lumps in my neck and had night sweats. It turned out to be stage 4 Hodgkin lymphoma. This was 6 years ago. Story 14. My first cancer turned my skin yellow. Doctors found type 3 non-Hodgkin lymphoma pressing on the duct from my pancreas and gallbladder. My gallbladder was also diseased. They placed stents in the duct, and after chemotherapy I recovered. 6 years later my neck began to swell, and doctors determined I had the same lymphoma near my thyroid, which had also become diseased. They removed one lobe of the thyroid, but the other lobe later grew aggressively and constricted my throat so I could not speak or eat, so they removed it as well. After another round of chemotherapy, I recovered again. I have since been diagnosed with follicular lymphoma, which means my lymph nodes can become cancerous if they are stressed. I am watching for my appendix, spleen, or another organ to become affected. Story 15. I was much more tired than usual and assumed my depression had returned, so I scheduled a visit. I had no other symptoms. Before that visit, I had donated blood. A physician from the Red Cross called and told me I needed laboratory tests again as soon as possible. As a medical transcriptionist at the time, once he mentioned blast cells, I knew what those tests would be looking to confirm. After the requested laboratory results returned and I had a bone marrow biopsy performed by the oncology team, I was diagnosed with chronic myeloid leukemia. Because I had donated blood only 2 months earlier without incident, the leukemia was caught very early. I am now a 12-year survivor. Story 16. My 10-year-old daughter had pain on her left side. There were no walk-in clinics or family doctors in the area, so we had to take her to the emergency department. We went back multiple times over 6 months as the pain worsened. On December 4, 2023, they found a tumor. It was neuroblastoma. We finished treatment this March. Her medical team used every available treatment: chemotherapy, surgery, radiation, a stem cell transplant, and immunotherapy. She is still on maintenance medication. She is now back at school and becoming a normal teenager. I am angry. My daughter's cancer did not have the urine markers. She was misdiagnosed at least 6 times. Twice we were sent home with antibiotics for a urinary tract infection. The first doctor told us it was menstrual pain, asked what testing I wanted, and then refused to do anything. The doctor who finally sent us for an ultrasound said they probably would not find anything, and then they found a baseball-sized tumor. Story 17. At the gym, I was sitting on the ground, ready to do a straight leg rope climb that I had been doing every day for months. One day, there was an unusual internal tug deep in my pelvis. It was not pain but a new sensation. Over the next week, the sensation returned every time I climbed the rope. The sensation did not correspond to any body part one could identify. I am a physician and I saw my primary care doctor, telling them that something was not right. A computed tomography scan demonstrated metastatic prostate cancer. Story 18. I am a radiographer, an X-ray technologist. Some people present with classic signs, for example, weight loss, iron deficiency, and rectal bleeding, which in many cases indicate bowel cancer. Others, and this is frightening, turn up with vague or no symptoms. I once had a patient who was very fit and healthy fall off a ladder. We scanned him from head to toe and found a dozen broken ribs, lung cancer, and a brain aneurysm. If he had not fallen off the ladder, he might have died. Interventional radiology treated his brain aneurysm, and 6 weeks later, he underwent a lung lobectomy. He was doing very well 5 years later. Can be random. Story 19. I had stage 4 pancreatic cancer. For me, it started as pain in my right side. I am not the type to run to the doctor at the first sign of pain, but I went this time. It was a good thing I did because the pain disappeared about 2 weeks later. Had I not gone then, I probably would not have known about the cancer for another 6 months to a year. In July, after more than 2 years of chemotherapy, I had surgery and my tumors were removed. I currently have no evidence of disease. Story 20. I was otherwise in good health but had a weak urine stream and had to get up multiple times at night to urinate. My prostate-specific antigen level was within the normal range, but my doctor sent me for a magnetic resonance imaging scan. It showed a large lesion protruding from the prostate. Turned out to be a rare, aggressive prostate cancer. Gleason score 9, stage 3A. I learned all of this after surgery. My local urologist said radiation was my only option, so I sought a second opinion at the University of California, San Diego, and connected with the best urological surgeon in the United States. It has now been 4 years this month with undetectable prostate-specific antigen levels and no incontinence. Erectile function returned within a year with a medication for erectile dysfunction commonly called the blue pill. At my house, the surgeon ranks somewhere between Jesus and God. Story 21. My 16-year-old son showed me his bleeding gums one morning. I thought it was strange and got him a dental appointment for the next day. At lunch, he showed me purple, freckle-like spots that had appeared on his feet. I called the triage nurse at our family clinic to ask whether this was a dental issue or a medical issue. She told me to take him to the emergency room immediately. I did, and he was diagnosed with acute promyelocytic leukemia and transferred by ambulance to the Children's Hospital an hour away. They started chemotherapy immediately because he was high risk with a very high white blood cell count and had disseminated intravascular coagulation, meaning he was internally bleeding because he had no platelets. He was an inpatient for 17 days and received 50 blood product transfusions, most of them platelets. After 9 months, with 4 cycles of 30 days of intravenous arsenic chemotherapy administered 2 hours per day, Monday through Friday, paired with oral tretinoin, he achieved molecular remission and beat the disease. He has been off therapy since mid-June. He spent his summer hiking, fishing, and camping, as if nothing had happened. He is back in school with straight A's and is aiming for college scholarships to pursue wildlife conservation. Story 22. I usually eat a piece of chocolate at night as a dessert. One night, after I went to the bathroom to shower, I noticed my white shirt had brown spots. I thought I had dropped chocolate on myself and it had melted. A month later, the same thing happened, but I had not eaten chocolate. My wife, who has a degree in chemistry, sprayed hydrogen peroxide on the stain. It bubbled, indicating blood. I called the hospital and they ran blood tests. They told me it could be a breast tumor or a brain tumor and suggested I get magnetic resonance imaging scans. I had both scans with contrast in the same week. It turned out I had both a breast tumor and a brain tumor. Story 23. My husband started having neck pain, which he attributed to the heavy bulletproof vest that had just been added to his required work uniform. It got significantly worse over a few weeks, and his hands began shaking, so he had to take a leave from work because he could not handle weapons with trembling hands. The doctor kept dismissing his pain as arthritis and said physical therapy and ibuprofen would cure it. After 3 months of this, I finally refused to leave the doctor's office until magnetic resonance imaging was ordered. It showed a large tumor at the base of his skull that had fractured his neck at the second and third cervical vertebrae. Only the tumor was holding his neck together. A biopsy showed high-grade metastatic sarcomatoid carcinoma with an unknown primary site. After 2 courses of chemotherapy and 10 sessions of radiation, they scanned him again and found the primary site, a large tumor in his brain. Only then did we learn they had never scanned his head before. The chemotherapy was not able to cross the blood-brain barrier, so it would not have helped. He passed away 2 months later. Always advocate for yourself and your loved ones. No one else is watching out for us. Story 24. My mother was diagnosed 4 months earlier, and my doctor referred me to a high-risk clinic for a genetic workup. It turned out I also had breast cancer. Story 25. I had blood in my urine, felt full after eating very little, and experienced intermittent severe abdominal pain. A massive tumor ruptured. It was ovarian cancer, stage 1C. Story 26. I do not have cancer myself, but my little brother did. He was 15 and began having growing pains. At a celebratory event for our favorite sports club, he asked if he could sit down in the middle of 10,000 people who were jumping and celebrating. He was in so much pain he could not stand. The next day we took him to the physiotherapist, who sent him to the hospital with our dad. It turned out he had a tumor in his upper leg. It was a rough year for him and our family, but he experienced a healing miracle the doctors could not explain. Last summer we celebrated his 22nd birthday. He has been cancer-free for 5 years. Story 27. Not me, but my mom. She was frequently nauseous and had a splitting pain in her side that would flare up and leave her bedridden. Over 6 months, she gradually became totally bedridden and barely ate anything. She had a computed tomography scan that showed a strange spot on her lung that could account for the pain. After several months of additional imaging and specialist visits, we finally received confirmation that it was cancer, but not the kind we expected. It was a recurrence of breast cancer that had been in remission for more than 30 years, and it had spread widely. A positron emission tomography scan showed extensive activity in her skeleton. Her spine and pelvis were full of tumors. It was stage 4. Thankfully, treatment for breast cancer has advanced. She takes an oral chemotherapy pill every day, and her pain and mobility improved rapidly. Subsequent scans show the tumors shrinking and not spreading. She was on a second chemotherapy pill, but it was too hard on her and was discontinued after several months. Other treatment options are being discussed. She no longer needs mobility devices and can get around on her own. Her back is sore and she has occasional nausea, but her quality of life is much better and she is as optimistic as she can be. We are treating this as a chronic condition. There is no cure, but we can manage it and hope to give Mom more good years and the chance to do more of her bucket list. We do not know how long that will be. Please listen to your loved ones when they say to go to the doctor. My mom had that pain for more than a year and was essentially trapped in bed by pain before she saw a doctor. I regret not pushing her harder. What if we had found the cancer earlier when it had spread less? Story 28. I have diabetes. I had a routine visit with my endocrinologist and mentioned that I am constantly cold at night, even at about 85 degrees, and I want to sleep under a comforter with the heat set to low. An ultrasound found a nodule that was borderline, and a biopsy was indeterminate. An Afirma gene expression classifier test indicated a 75% chance of malignancy. I decided to have surgery to remove the thyroid 10 days ago. The pathology report returned on Friday and confirmed thyroid cancer. Fortunately, it appears to have been completely removed. I am still feeling cold, but I have not started thyroid hormone replacement yet. Story 29. I was diagnosed with melanoma at 36. I had no symptoms and no family history. I went in for a skin check, The doctor found for similar moles. 2 were concerning enough to biopsy, and 2 she wanted to monitor for changes. One of the first biopsies came back precancerous, so I returned to the office to have more tissue removed. I asked my doctor to remove the other 2 moles while I was there, and she agreed. One of those was melanoma, and it was surgically removed earlier this year. I now have quarterly skin checks and, thankfully, there have been no recurrences so far. Get your skin checked. Story 30. My cousin had numbness in her fingers. At first it was thought to be a pinched nerve, but physical therapy and cortisone shots provided no relief. They performed multiple imaging studies and then diagnosed her with an aggressive form of brain cancer. She was diagnosed in June and died before Thanksgiving. Story 31. Unexpected lump noticed while showering. It grew and became uncomfortable. An online medical resource suggested cancer or a viral infection, but I did not have the additional symptoms of an infection. I saw a doctor who sent me for an ultrasound, which led to surgery. Testicular cancer can progress quickly. They did not tell me the stage, but they did tell me the type, and the surgeon changed his vacation plans to get me treated a few days sooner. He must have done a good job because I am 17 years cancer-free. Story 32. The only symptom I had was swollen lymph nodes on the right side of my neck. I put off getting it checked until the lymph nodes formed a large mass at the top of my neck that stuck out about an inch. At 21, I was diagnosed with stage 3 Hodgkin's lymphoma. It involved both sides of my neck, both armpits, my spleen, and my back. I am happy to report I have been in remission for 3 years. Story 33. I've shared this before. I'm on mobile, so forgive any errors. I had been having heavy and irregular periods. I would go for months without one and then bleed so heavily I went through overnight pads in 15 minutes. I passed clots the size of my fist. After spending a fortune on maxi pads, I decided that I had health insurance and should figure this out. I looked up what my insurance would cover. I drove there in my pajamas, sitting on a 4 times folded bath towel. The emergency room was dead quiet. I told the front desk receptionist that I was bleeding heavily, and she gave me a look as if to say, "Why are you bothering us? It's just your period." When I got to the back, the towel was almost soaked through. I was bleeding so much that they could not see inside my uterus to find the source. They even put a condom on the speculum like a little submarine. I had a dilation and curettage, and they found a tumor hanging down from my uterus into my cervix. It was stage 2. It turned out that each time I had a period, the tumor moved, tore away from the lining, and caused heavy bleeding. I had to have a transfusion because all the poking and probing made me bleed worse. I had a Da Vinci robotic hysterectomy with removal of my ovaries, fallopian tubes, and cervix. No chemotherapy, no radiation. The only complication was that removal of my lymph nodes gave me lymphedema, but I had always been a large, heavy woman. Story 34. I have been cancer-free for 2 years. I had no symptoms. A routine mammogram found a small tumor measuring 0.5 centimeters. Story 35. I was teaching in front of a class when a paraprofessional noticed a lump on my throat. I was diagnosed with thyroid cancer on both sides. That was more than 15 years ago. I am still doing okay. Story 36. Changes in the color of my urine were due to blood, which led to a cystoscopy and a diagnosis of bladder cancer. Story 37. I was passing blood in my urine every 7 days. I was diagnosed with early-stage bladder cancer 6 years ago. I underwent chemotherapy, and it has not returned. If you begin passing blood in your urine, see your doctor and a urologist. Story 38. I felt a sharp pain in my armpit, like someone had stabbed me, completely out of the blue. It turned out to be metastatic malignant melanoma that took 5 years to spread from a primary tumor removed from my shoulder to my lymph nodes. Story 39. A pea-sized blemish appeared on my skin. My doctor said it was almost certainly nothing, but because it hurt when touched, he biopsied it just in case. Thank God he did. I still had to undergo chemotherapy, but we caught it early. Story 40. The first time I had night sweats, fatigue, and brain fog. I was worried I was allergic to dairy, but thankfully I was not. I went to my doctor, He had just had a patient with similar symptoms diagnosed with chronic lymphocytic leukemia, so I was tested, diagnosed, and treated. 15 years later, I am all clear. Chemotherapy was brutal, as I received very strong drugs because I was only 30 at the time. The second time, I noticed blood in my bowel movements. After the third occurrence, I did not mess around. Any sense of invincibility was gone. I had a colonoscopy through the public health service and an aggressive early stage 3 tumor was found. I had half of my bowel removed and had chemotherapy. More than 2 years later, I am still all clear. That journey was not much fun. The third time, my sister had a mole map and found melanoma. We live in New Zealand, which has high rates, and given my general feeling of poor luck, I had myself checked for the first time in a decade. It was an early aggressive melanoma. They removed a decent chunk and it has not returned. I get checked regularly now and have a cool scar. Being proactive and some luck were the keys for me. I feel I have had enough, so I do not intend to go through it again. Fuck cancer. Story 41. I had stage 3 cervical cancer. I experienced watery discharge with a metallic smell, bleeding between periods, and horrific menstrual periods. I had a Papa Nicolau test 2 years earlier and a pelvic exam 1 year earlier. Both detected nothing, so I was not too worried until these symptoms appeared. When my obstetrician gynecologist examined me, she said she could see a tumor protruding. It turned out the tumor was growing toward the uterus, so the cytology brush missed it. For months into treatment, my lymph nodes had returned to normal and the tumor was almost gone. I underwent 6 weeks of chemoradiation with immunotherapy, then 4 brachytherapy procedures. I finished treatment 8 months ago. My last 2 scans were clear, and I am feeling great aside from the effects of radiation. I am very lucky to have been considered curable at my stage and tumor type. My oncologist said many women ignore those symptoms and do not see a doctor. Please get the human papillomavirus vaccine for yourself and for your children. My mother did not have me vaccinated because of misinformation and fear, and I thought I had been vaccinated because I had received other vaccines as a teen. There is strong evidence the vaccine is saving lives and preventing this cancer. Story 42. I felt a new lump on a testicle and mentioned it several months later at a primary care visit. The doctor did not feel anything but ordered an ultrasound. The ultrasound showed a mass in a completely different location from where I had felt the lump. The mass was diagnosed as a seminoma. The oncologist staged it as stage 1A, and after surgery I was told it was 95% likely not to recur. Story 43. I was 38 years old and had no symptoms. I felt healthy and fit. I went to the doctor for an unrelated reason, and while I was there they said I was overdue for a smear test. It was diagnosed as stage 1B cervical cancer. The surprising thing was that I had a smear test about 16 months earlier that was normal with no human papillomavirus detected. Because I had lived overseas and had no smear history on record, the doctor wanted 2 smear tests 1 year apart to establish a baseline. They caught it so early that they think the cone biopsy removed the whole tumor. By the time I had a radical hysterectomy, there was no cancer left in the tissue tested. Now it feels like such a blip on the radar that I struggle to say I had cancer. Get your cervical screening smear tests. Story 44. I knew my mom had cancer. We went for a brief visit, and she told me it had been a few days since she had a bowel movement and that she planned to see her primary care physician in a few days because her bowel movements had been irregular. I told her to go to the hospital. She did, but the wait was too long at the Hospital Corporation of America facility. She waited for her primary care physician and was immediately admitted. My parents did not call me until later that evening, which was unusual, and I just knew. She was diagnosed with stage 4 gynecological cancer. The tumors were so large they pressed on her intestines and had spread to her large intestine, small intestine, and appendix. When we met with her oncologist the following month and I read the tumor sizes, I asked how long she had actually gone without a regular bowel movement. She said a few months. She is doing better now, but there is still a long road ahead. The lesson here is, if your bowel movements change, see a doctor. Story 45. I had itchy skin, night sweats, coughing, weight loss, and lack of appetite. I was diagnosed with Hodgkin's lymphoma in January 2024, relapsed 6 months after finishing treatment, and just completed a stem cell transplant in August. I am keeping my fingers crossed that the transplant worked. Story 46. I did not really notice any symptoms. Only a few weeks before I was diagnosed, I began to have a very mild 1 to 2 out of 10 pain under my left rib cage that felt like a pulled muscle. Persisted for weeks. After about 3 weeks, I went to the hospital. I waited a long time to be seen and was given a relatively cursory exam to rule out appendicitis. I was told it was probably gastroenteritis and sent home. I went on vacation for a week and the pain was still there when I returned. Every once in a while, I would get a very short, few-second stabbing pain just above my groin. When I returned to the emergency department, the doctor sent me for a computed tomography scan. The scan revealed my colon was perforated. They suspected diverticulitis and scheduled me for emergency surgery the next day. Around 3 in the morning, the surgeons delayed the operation after reviewing the computed tomography scans and consulting the radiologist. They scheduled a colonoscopy to investigate further. During the procedure, they reached a baseball-sized mass in my colon that had perforated the bowel wall. I was nearly completely obstructed, and they were surprised I was not in severe pain. Because of the perforation, bowel contents leaked into my peritoneal cavity. I developed peritonitis, and I was progressing toward full-blown sepsis. I was classified as high-risk stage 2. There may have been signs I missed. One possible sign was ribbon-like stools, but I did not check and did not notice. I was not aware of any blood in my stool. If there was any, it was minimal. Bowel movements were sometimes long and thin, like squeezing dry toothpaste from a tube. One sign I had but did not recognize was gastroesophageal reflux disease with significant belching. Often after dinner, I felt severe chest pain, like food was stuck, followed by a sharp pain that then passed. A year before my diagnosis, I saw a gastroenterology specialist and had an endoscopy that revealed esophageal narrowing, so I had an esophageal dilation that helped. The actual cause was the tumor, which prevented passage of gas through the lower bowel and instead allowed gas and stomach contents to travel back up my throat, bringing acid with it. After surgery to remove the tumor, that entirely cleared up. Initially, I thought I was lucky. They removed the tumor, and I was put on a prophylactic course of chemotherapy for 6 months. About 5 months in, my hemoglobin levels began falling. I was bleeding internally. At the 6-month mark, when I was supposed to finish chemotherapy, scans and an endoscopy showed the cancer had spread to multiple sites. I was told my case was terminal and given 6 to 12 months. That was 6 months ago. I have had a couple more surgeries and am hoping for one more major operation. I am on my 2nd chemotherapy regimen and am about 6 months into it. I have a number of aggressive mutations that are associated with poor outcomes. My family history is otherwise one of longevity. My grandmother died at 105. Her parents lived to 99 and 100. My brothers reached 95 and 97. Other grandparents lived into their late 80s. Among about 20 aunts and uncles, only one had cancer, and among roughly 60 siblings and cousins, there is no cancer. Further back in the family tree, there is virtually no history of cancer. I just got a bad roll of the die. Summary: I had basically no obvious symptoms. I had a baseball-sized tumor that had likely been growing for years, and only when it perforated my colon and infected my peritoneum did I start to feel even mild pain. My stools were likely ribbon-shaped, but I never noticed. I do not recall visible blood, although that is common. I had gastroesophageal reflux disease and frequent belching caused by the tumor. Story 47. I thought I was going through menopause. My periods had always been irregular. I had pelvic inflammatory disease when I was younger, but they were becoming more irregular than usual. I went to see the doctor. He ran blood tests, sent me for an ultrasound, and said I was too young for menopause and that it must be because of my weight. He did not refer me to a gynecologist. He told me I needed to say no to the cake and biscuits and go for an evening walk. A year later, I started bleeding and did not stop for a month. I went back to the doctor and he again blamed my weight and complications from the pelvic inflammatory disease. 5 months later, I was still bleeding lightly on and off, but there was blood every day. Then, while getting groceries out of the car, I banged my abdomen on the tailgate and experienced severe pain. I took some paracetamol and went to bed. The next morning I woke up covered in blood. It was on the sheets and the duvet cover and had soaked through the mattress protector to the mattress. I panicked, went to the hospital, and within 4 hours I was having an emergency dilation and curettage and a blood transfusion. The tissue removed was sent for testing. It turned out I had endometrial cancer, and it was very likely present 18 months earlier when I first saw the doctor who told me to lay off the cake and biscuits. Story 48. It felt like a hair was stuck at the back of my throat. It turned out to be a small tumor on the back of my tonsil, about the size of a pencil eraser. I was stage 2 with lymph node involvement. Story 49. I am a 42-year-old woman and was completely pain-free and feeling incredibly healthy until 4 months ago, when I began experiencing severe back pain that I could not localize and a very nervy feeling. My whole abdomen started bloating, and I had stabbing pain throughout my stomach constantly. Initially, they thought I had gastritis, but because it did not resolve, we performed an ultrasound. They found 7 tumors on my liver, which led to 2 months of every scan and test possible. I have been in unrelenting pain for over 4 months. They still cannot find the primary cancer. My body may have eliminated it, but I have metastatic tumors on the outside of my stomach, one on my hepatic portal and on my liver. I have cancer of unknown primary, and I am starting my 2nd round of chemotherapy tomorrow. I cannot wait to shrink these tumors so the pain stops. I am going to smash it. Story 50. A friend lost his father to leukemia. When his wife noticed red pinprick marks on his skin, she insisted they get it checked. He was diagnosed as leukemia, but he received a bone marrow transplant and is doing well now. Story 51. My 4-year-old, who was 3 at the time, developed an unexplainable persistent limp with pain that would not go away. He was diagnosed with stage 4 neuroblastoma last December. He was metastatic, and the limp was due to cancer in his bones. Edited to add, it took a month from when we realized the limp was not going away to getting a diagnosis. I had to fight to be seen by doctors at first, but once they realized it was serious, they got us in as soon as possible. We are based in the United States. Fortunately, pediatric care in our hospital system is prompt. We have been through hell and back fighting this, but he is currently thriving and his most recent scan showed no detectable cancer. We still have a ways to go, but we are hopeful. Story 52. Not me, but my husband. In his early 40s, his boss paid for all employees to have lab work done at our local health fair. Even though he was young for the prostate-specific antigen test, he had it because it was free. It saved his life. Story 53. My mother had bouts of constipation with abdominal pain followed by diarrhea. The cycle continued and worsened over time. It developed gradually, and she kept hiding it and trying to power through. After seeing an unhelpful doctor, undergoing an attempted colonoscopy, experiencing an ambulance ride, and having emergency surgery, she was diagnosed with metastatic stage 4 colon cancer. Story 54. I had a migraine. Then suddenly half of my body went numb and I had severe aphasia. When I tried to speak, only gibberish came out. The doctor in the emergency room said it was probably just a bad migraine and most likely not a big deal. It turned out that I have brain, neck, and spine cancer. My meninges are carrying cancer throughout my central nervous system. I am still here after 4 years. Story 55. I had pain in my bones for about 4 months and did nothing about it. Then I noticed my posture was changing, but I still did nothing because my life was busy with work, commuting, children in high school, and my wife growing more distant. One day at work I sneezed and broke a rib. The next day I went to the urgent care clinic. I waited for several hours while they ran blood tests. The doctors came in and said I needed to go to the hospital and start chemotherapy immediately. I could not go home first to get a toothbrush or pajamas. They said I had about 2 weeks before extreme organ failure leading to death. The chance of surviving a few more months was less than 1%. Multiple myeloma, a bone marrow cancer. In multiple myeloma, bone tissue is resorbed, causing bones to weaken and fracture. The released calcium damages the kidneys and other organs. That was 14 years ago this Thanksgiving. I underwent several rounds of chemotherapy and a stem cell transplant. I still take expensive medications daily, but I am in good health. Divorced, I sold everything I had, got my children through college, and now live a simple, minimalist lifestyle. I am content. Story 56. I have stage 3 Hodgkin's lymphoma and my symptoms were fatigue, night sweats, and a dull stomach ache that would not go away. I am a teacher and was diagnosed in the spring, so I attributed the fatigue to end-of-school year tiredness. The night sweats were odd, but I did not think much about them. The dull stomach ache is what made me seek medical attention. I just had a feeling something was not right. I was not expecting cancer. Most people are diagnosed with lymphoma because a visible lymph node in the neck, armpits, or groin is swollen. You also have lymph nodes internally, which can make diagnosis harder if you do not recognize other symptoms. My cancer was found in my abdomen, mostly surrounding my kidneys and along my esophagus. Hodgkin's lymphoma is thankfully very responsive to chemotherapy, so I am expected to be in remission by Thanksgiving. Story 57. My daughter was diagnosed at 3 years old. She started complaining of a sore head and a sore nose. Over the course of 10 days, she became very unwell, lethargic, and began vomiting, but oddly had no fever. The absence of fever with all the other symptoms worried me, so I took her to hospital. They took me seriously and she had a computed tomography scan. They found a tumor in her sphenoid sinus. 5 days after going to hospital, we had a diagnosis. During that week, she had a magnetic resonance imaging scan and a biopsy through her nose. She had chemotherapy for 8 months and is now a healthy 14-year-old. Because we are in Australia, her treatment cost us nothing apart from hospital parking. Story 58. 22 years ago, I was 27 years old and found a lump behind my clavicle. My only symptom. I never felt ill from the cancer. I was diagnosed by computed tomography and biopsy. It was determined to be stage 2B Hodgkin's lymphoma. The B stood for bulky. It was stage 2 because it was still only above the diaphragm, but bulky because a lymph node was 13 centimeters in diameter. I had 6 hellish months of chemotherapy followed by a month of radiation. My age, the lump I initially found, and the way I responded to treatment were all textbook. They never used the word remission. They eventually called me cured. I am Canadian and very fortunate to have received the treatments that saved my life without having to bicker with insurance. Story 59. I experienced chest pain, arm numbness, and a decreasing ability to walk. My condition worsened over about 6 months, but the pain had been present for 5 years. It was not detected because people my age almost never get this type of cancer, and an injury to the chest masked the symptoms. They do not use stages for my cancer type, but mine is considered standard risk. There is currently no cure, but the disease is treatable. I am glossing over the physical damage it has caused. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.